Good evening, all. Uh, Thank you very much for patiently waiting for this broadcast. We are so sorry that we are starting behind the schedule. This was as a result of technical errors. Well, my name is Dr. John Dickson, a consultant obstetrician and gynecologist with the Department of Obstetrics and Gynecology at State University Hospital, and a senior lecturer at the Department of Obstetrics and Gynecology, College of Medical Sciences, Rivers State University Teaching Hospital, and the CEO of Beulah Specialist Hospital Limited. This evening we'll have an interesting discourse, and we are looking at uterine fibroid. Uterine fibroid is one of the most common um, benign tumor, that is swelling in the uterus, which is what we commonly call the womb, in the women of reproductive age between the age of 15 to 45. And then these fibroids account to about 20 to 30% of women of this category. In Nigeria alone, per year, you can have about 100,000 cases of uterine fibroid. Uterine fibroid is just a growth, an abnormal growth in the body of the uterus, which is womb. It forms like a cycle round nodules within the womb of women of reproductive age. Now, the cause of uterine fibroid is not commonly known, it's not very clear, it's not really known. But however, there are some risk factors that could result that make man stand the chance of the risks of having a fibroid. So some of these risk factors are, number one, age. Fibroid is more common in women of reproductive age of advanced age. Maybe a woman that their ages to 35 and above within the reproductive period. They are more prone to have uterine fibroid compared to the younger age women. And then not only that, race. It has been found that fibroid is more with the blacks, the Africans, compared to the Caucasian, that is the whites. Well, the reason may be our genetic disposition, but that is what has been found out. And then also the women that who have not given birth, maybe they've gotten some age, 30, 35, and they are not giving birth. That is those that we call nulliparous women. Nulliparity has been noted as a risk factor for uterine fibroid to grow. And then family history. Maybe a mother who had fibroid, the daughter is fibroid, the child or the woman, the reproductive, who's the auntie, have uterine fibroid, is more likely to develop fibroid compared to other women in the society. It has also been noted that those who are obese, those who have weight, who have bigger in size, they have the risk of having uterine fibroid more than the other people who are slim, who are slimmer compared to their weight. And then not only that, women who started puberty early they also have the higher risk of having a fibroid than the women who have delayed puberty. This probably could be as a result of hormone It has been shown that estrogen, a particular hormone, is increases the risks, the chances of developing, helped in the growth of fibroid. Also, some studies have shown that some deficiency in some vitamins, like vitamin D, has also been shown that it will increase those women who have deficiency in vitamin D have more risks of developing uterine fibroid. Then sometimes the food we eat, some food, like food that have some additives, some things, and then food that are fatty in nature, have also been shown that to increase the risks of uterine fibroid. Now, when we talk about this now, you can see that the risk for uterine fibroid is so much that a woman of reproductive age who is nulliparous, who have not given birth, will have a chance of developing fibroid. As they commonly say that the womb does not want a vacuum. If there is no baby there, it means that fibroid will have to grow. This fibroid we're talking about, even though we say that fibroid is on the womb, which is the uterus, there are different locations that the fibroid can be. The womb as itself have different components. They have the back, the outer part, what we call the serosa. It has the middle part we call the myometrium, and then the inner part we call the endometrium. So fibroids can be located in the various parts of the womb, which is the uterus. If it can be located on the outside, they will call that serosa. And then those ones that are the outside of the womb, sometimes they become so big and they have a stalk. They have something that connects into the main fibroid. Then that can now be called pedunculated. Those ones will just have a stalk from the top of the womb and then it grows attached to the fibroid itself. So that one we call it pedunculated fibroid. Then you can have it within the wall of the womb, which is the myometrium. So that one we call it intramural. It's within the wall, the muzzle wall of the womb, called intramural. And then it could also now be located inside the cavity where baby stays. So that one we call a submucous. Sometimes you can have this submucous fibroid that can also grow a stalk, grow something that looks like a tail that will connect it to endometrium, which will also be pedunculated. So, and then fibroid can as well also be located around the cervix. Cervix is like the mouth of the womb. Fibroid can be located there. Fibroid also can be found in the ovary. Some women fibroid can get to the ovary and then to where we call the broad ligament. So, and the location of this fibroid will determine the kind of symptom and sign the person will present. And that's why everybody do not present in the same way when they have fibroid. There are some people that will have fibroid and they will not show any symptom. And that's what we call clinical presentation. Clinical presentation, they say, how do somebody who have fibroid, how does it show in the life of the person? So the location of this fibroid will determine how the person, that will manifest in the life of the person. So if fibroid is within the cavity, that is submucous, you see that most of the time, this woman that have this type of fibroid will be having heavy menstrual flow. And that will call, what we call menorrhagia. That is the flow, the monthly flow will be so heavy. Sometimes it becomes longer than the number of days that it should be. Sometimes you see it will become so bad that the normal pad that the woman is using for the normal menstrual cycle can no longer contain the menstrual blood. And so they will have to need sometimes some people even use a towel to contain the blood. And then sometimes if the fibroid is within the wall and it's not too big, you see that such people, they have the fibroid but they will have their normal menstrual flow. If it's on the outer part, then the woman can still be having a normal menstrual flow. So it's not all fibroid that will come with heavy menstrual flow. So you will not say, oh, if my period is not heavy, then I don't have fibroid. So it depends on where it's located. So that the fibroid can be in the inside the wall, that's intramural, but it can now bulge into the endometrial cavity by so doing to increase the surface of the endometrium where baby used to stay during pregnancy, and that can also result to heavy menstrual flow. Fibroid too can also cause painful menstruation. You see some women when they are menstruating, they are so much in pains. Sometimes it's so bad that they needed to be admitted in the hospital and treated. So depending on the location of the fibroid as well. And then some, because of the fibroid, if it is at the back of the womb, it will press upon the rectum where feces are collected, where the person defecates freely. So when the fibroid presses on it, it can result to constipation. You see that somebody cannot go to toilet. If you want to go to toilet, the feces cannot come out. That can result to constipation. If the fibroid is also big and is on the anterior surface, that's the front of the womb, it can be pressing on the bladder, urinary bladder. That is the organ that collects urine. And you see that the person will be having frequent urination. Every time you go to urinate, when you urinate before you know, you go again. So sometimes people will think that the person is having diabetes, but the fibroid itself can cause that kind of symptom. And then in some people, depending on the size and where the fibroid is located, it can cause swelling of leg, what we call pedal edema. And you also see somebody, the leg is swollen. I'll be wondering what is happening. Some will think that, oh, the person is poisoned. See how the leg is swollen and then the stomach is big. You know, think it's poison, but that could be caused by fibroid. I remember a case where a lady, a young girl, was sent by the parent to the hospital. They just noticed that her leg has swollen, her stomach is big, and they were afraid that she's becoming very sick and all that. But by the time we check, we discover that this young lady had uterine fibroid. So the symptoms and the presentation of fibroid different from depending on where it is located. It's not the same for every woman, since the location may not be the same. And there are some things that could present like uterine fibroid. Yes, that is what we call differential diagnosis. And there are some conditions that can mimic fibroid. That's what we mean by differential diagnosis. Number one, normal pregnancy. Normal pregnancy can be a differential of uterine fibroid. You see a woman is pregnant and he doesn't know, and then you'll be thinking he's having fibroid. I also had a situation whereby a young lady like that, the parents sent her for operation for fibroid, and then her leg is swollen and all that. So, but by the time I checked and did a scan, I discovered that it was pregnancy, 6 months pregnancy, and it was unbelievable. So that normal pregnancy is a differential of uterine fibroid. And then there is also what we call adenomyosis. Adenomyosis is also an abnormal growth on the womb, that is the uterus. But it's different from fibroid in the sense that the adenomyosis will take over the entire womb, all over, from the outer to the middle to the inner part. So that one is different from fibroid, but you have the same presentation, same symptoms like fibroid. But in the case of adenomyosis, when the woman is seeing her period, she's going to have pain from the beginning of the period to the end of the period. And the pain is usually more than the pain that will be seen in fibroid alone. And also the bleeding, the heavy menstrual blood is usually more for adenomyosis than uterine fibroid. So sometimes some women that will think that they are having fibroid, by the time we check properly, we discover they are having adenomyosis. Ovarian tumor, the ovary is an organ that is close to the uterus. The ovary is the organ that releases the egg for women to get pregnant. Sometimes they have abnormal growth on it. That's called what we call ovarian tumor or ovarian cyst. And when that happens, you could also think that that is a uterine fibroid. But during gynecological examination, we'll be able to differentiate uterine fibroid from ovarian tumor. Then, are there some complications of fibroid? A woman who have fibroid, are there some things that this fibroid can cause to the woman? Yes, of course, there are some problems that fibroid can cause to a woman that have fibroid. Number one, a woman that have fibroid and each time she sees her period, the period is usually very heavy. The woman will become anemic. When we talk about anemia, is that the woman blood level will be low, and when the blood level is low, it will make the woman faint, the woman weak, like a young lady of 16 years old who had uterine fibroid. Each time she sees her period, she will bleed until she will faint, and then she will need to be admitted in the hospital and given blood. So that is what we call anemia, having a low blood level, blood shortage. So fibroids can cause that kind of thing to a woman. And then fibroid as well can cause what we call repeated miscarriages. If the fibroid is in the cavity, that is some mucous fibroid, it will not allow the baby, that is the egg that is fertilized, to settle in the womb. So each time it comes to the womb to settle down, fibroid will cause a miscarriage. So a woman that's having repeated miscarriage, recurrent miscarriage, that could be a complication of fibroid. Also infertility. Generally, we gynecologists will believe that fibroid alone cannot be a cause of infertility, which is true because sometimes women who have fibroid, they also get pregnant. But depending on the location of the fibroid, if the fibroid is located close to the tube, the opening of the fallopian tube, the tube where the egg and the man's sperm cell will have to pass through to meet. If the fibroid is located there blocking that place, then there will not be pregnancy. So pregnancy will not occur. And that will result to what we call infertility. A woman who has fibroid, depending on the size of the fibroid, and is pregnant, sometimes the woman will have some complication in the pregnancy. She may have pains, very severe pain, that at times she will vomit, become very weak, and she will need to be admitted in the hospital. This is as a result of what we call red degeneration. And so that is why women who have fibroid and get pregnant, you see that from time to time they will having stomach pain, and all that. That is part of the complication of fibroid. And then you can also have a preterm labor because fibroid is there in the womb, the baby is growing. There's competition between the baby and the fibroid. So the womb at times gets too much enlarged. You see a woman who is just 13 weeks pregnant, that is 3 months pregnant. By the time you examine the womb, the size of the pregnancy is almost 26 weeks. It is double. 6 months is double the size of the pregnancy. So as the pregnancy continues to get to a point that the woman can go into preterm labor and deliver preterm baby because of the fibroid not allowing enough space for the pregnancy to grow. And then fibroid, also there are other complications. If the woman that is pregnant with fibroid, because of the fibroid occupying space in the womb, it will not allow the baby to really grow very well. And that baby can have what we call intrauterine growth restriction. It will not allow the baby to grow very well, to grow to the normal size that it ought to grow. And that is a situation where we call intrauterine growth restriction. And then if the fibroid is located at the mouth of the womb, where we call the cervix, or the lower part of the womb, the lower uterine segment, it can result into what we call obstructed labor. Say a woman is in labor will be having labor pain 1 day, 2 days, you will not be able to push out the baby. So the pregnancy, the labor will be obstructed. The woman will not be able to deliver through the normal route, through the vagina, because of the fibroid that is blocking the baby from passing out from the birth canal. Then it also can also result during in pregnancy where the the placenta, there's what we call placenta when the woman is pregnant. It's what that link the nutrients from the mother to the baby. And so when there is fibroid, the placenta decide to grow towards the lower parts of the womb and result into what we call placenta previa. So you are seeing a situation whereby the placenta now lower down before the baby. In such cases, you see a woman will be having bleeding in pregnancy. So that can be a complication of uterine fibroid. There are other complications as well, like abruption placenta, because the fibroid is there, occupying some part of the womb, pushing out, and then at the end of the day, now it can force the placenta to separate prematurely. That's what we call abruption placenta. Normally, normal pregnancy is after the woman have delivered and the baby is out. That's when the placenta separates from the womb. But sometimes when there is fibroid, you see that fibroid, because it has affected the contour of the womb, it will now cause this premature separation from the womb, of placenta from the womb, and that will result to bleeding. Sometimes it can even lead to the death of the baby. And if care is not taken, the mother could actually also have a problem. And then fibroid in pregnancy will increase the risk of cesarean section. Just as I have said, if fibroid is located in the lower uterine segment, there is no way the woman is going to deliver vaginally, and so it will result to cesarean section. Then a woman who have fibroid after delivering stand the risk of having bleeding after delivering, what we call primary postpartum hemorrhage, because the fibroid will not allow the womb to contract. Normally, after a woman have delivered, the womb will contract, and that contraction will reduce the incidence, the chances of bleeding, because as the womb contracts, all the blood vessels are compressed so that bleeding will not occur. But when there is fibroid, that contraction will not be very adequate. So the woman will stand the risk of having primary postpartum hemorrhage after giving birth. And then because after giving birth, normally the womb reduces in size, reduces in size as the time passes until about 6 weeks, the womb will go back to the pelvis. But a woman who have uterine fibroid, after delivering, that returning of the womb back to the normal size, what we call uterine involution, will not be very adequate. So the woman will have what we call uterine sub-involution. That is, the womb will not return back on time. It will be taking time to return back. So it will make the woman's stomach to be very big, just enlarged. And that's because of the presence of fibroid. And because the womb is not able to return back normally the way it should be, it can also result into infection, what we will now call puerperal sepsis. That's a woman after giving birth having infection, and that can cause problem both to the woman, because if the infection is allowed to spread, it can lead to a very difficult situation for her. So these I've mentioned are some of the complications of uterine fibroid, and that is why when there is fibroid, then it has to be properly taken care of. Now we go to the treatment of fibroid. What is the treatment for fibroid? You know, we are living in a society whereby a lot of people speculate things that could be used for treatment of various situations, various health conditions. You will go on the road, you hear people talking on the radio, talking on speaker, this one, that. And I want to say very quickly that there is no native drug that can melt fibroid. There is none. Sometimes people used to convince me and said, there is this drug you take, it will melt fibroid. There is none. And so the treatment of fibroid is something that one will have to take very carefully as seriously. You don't allow people to just deceive you to have some problem. Maybe in course of this discussion, I will get to tell us some of the complications that people have had because of the kind of treatment they receive from the advice of people. Generally, in the treatment of fibroid, if fibroid is there and it's not causing any problem, it's small in size, you don't need to bother about it. So you just have to be observing it. And that was what we call expectant management. You know, a lot of women have fibroid, but they don't know. It's only when they get pregnant, we do a scan. When we now do a scan, now say, oh, you have fibroid. So all those ones, you don't bother. We call them asymptomatic uterine fibroid. Fibroid that doesn't have a symptom. You don't need to bother about it. And so it is important for us to know that it's not all fibroid you worry about. Fibroid is small, it's not causing you a problem, you don't need to bother. But you need to be checking and be monitoring to ensure that fibroid will not grow. Maybe it has not grown to start causing a problem. Now, the other treatment is what we call non-surgical. Non-surgical, when you say non-surgical, it means that you're talking about non-operation. We'll give some drugs. The drugs we give medically is not just maybe to remove the fibroid, but is to help to checkmate the the problem that is the complication of fibroid. For instance, we can give some drug if a woman be bleeding and the bleeding is so much. We can give some drugs, injection or tablet to ensure that the bleeding is reduced, so that the person will not bleed until the blood become very low. So there are different drugs like that. Sometimes if the bleeding is so bad, we can even place the woman on hormonal drugs to make the period not to come for some months. Because if the period did not come for some months, she will not bleed, so that the woman can be able to regain herself. So there are drugs like that that can be given. But once again, I want to say there is no drug that will melt fibroid. Then there is another drug that can be given that can help to reduce the size. If the fibroid is so big, you can give those drugs to reduce. That is what we call gonadotropin releasing hormone analog, like the boserolin and all that. But these drugs are actually very expensive. And sometimes when you give the drug, you need to continue the drug. The moment you stop the drug, the fibroid will even become bigger in size. That's what has been observed. And then added to the cost of the drug, it's not very recommendable for people to use it. Then it also has some side effects of the drug. And so that is for the non-surgical treatment using the drug. We also have another treatment which is not surgical. We call HIFO. That is high intensity focus ultrasound treatment. There are some fibroid that you can use ultrasound scanning machine, high intensity focus to make the fibroid, to destroy the fibroid nodules. And by so doing, the fibroid is treated. But it's not for a very big fibroid. In Africa, the kind of fibroid that we have are usually very big. And so those ones does not really fit into the HIFO that is using ultrasound scan to treat it. It's a fibroid that are small and they are not multiple. In fact, studies have shown that Africans have most of the time multiple fibroid, that is plenty of it. But the white, sometimes they have one or two. And then the size is smaller. So in such cases, you can use HIFO, can use high intensity focus ultrasound scan to be able to treat that fibroid. Then we'll have the surgical method. Actually, the definitive treatment, that is the final treatment for fibroid, is what we call hysterectomy. Hysterectomy is a situation whereby the womb is removed entirely. And this method is good for women who have stopped giving birth. They've stopped giving birth, they start having their children, and they are just having the problem of fibroid, of heavy menses, pain, and all that. In order to solve that kind of problem, then that womb will have to be removed with the fibroid so that the person will not have the problem of the fibroid again. But for women who have the hope of giving birth to children, maybe probably they are not married yet, or they are married, they are still expected to have children, then that method will not be good, will not be the best method for such women. So we can do what we call myomectomy. Myomectomy is a kind of operation whereby the fibroid is removed from the womb. There are different methods of doing myomectomy. We have the one we call abdominal myomectomy. This is the one that is commonly known by so many people, and that is like open surgery, whereby the woman will be open, the belly of the woman will be open, and then the womb is brought out, and all those fibroid nodules are removed gradually, and then the womb close back and return so that the woman can continue having her children. That is abdominal myomectomy. The other form of myomectomy, other method of removing fibroid without necessarily cutting the woman open, and that is by the method of what we call minimal access surgery. Minimal access surgery. That is a method whereby without cutting the woman open, a fibroid can be removed. This one also is for fibroid that are not too big. Sometimes for women who have fibroid that will be up to 9 months pregnancy size, 8 months pregnancy size, 6 months and all that. So all those very big fibroid are not ideal for the minimal access surgery. You have laparoscopic myomectomy. That one will just put the instrument on the abdomen, the tummy of the woman, and then the fibroid is removed